Alright you guys, now we're on to the big gun treatment for our acne scars, which is superficial CO2 resurfacing. This is called Active FX. This is going more on the surface of the skin. We just did fractura for the deep part. We did fillers for the tethered scars. We did subcision. So now we're overlapping pulses with a very strong laser. The thing about this is you see the dots and there's not a lot of bleeding. But don't let it fool you because there's a lot of heat being generated here. That heat will go to the surrounding tissue and below. Unlike an erbium laser where there's a lot of bleeding and then there's less heat, this almost has no bleeding and then the heat is extending deep. So she'll have probably 4 to 10 days kind of peeling. It depends. Her skin, we haven't done a big treatment before, so I don't know how quick she will heal, but at this density, turn over to that. At this density, typically it's about a 5 to 7 day peeling. Now combining the fractura gives us a little bit more in terms of overall collagen production. Plus I'm doing a little overlap on her so that we get more of a result rather than spacing it out as much. So even though, and the reason I'm doing that is giving her a skin type, you want to be a little more cautious, so the energy level and the density have to be a little lower. But if you overlap them, you're creating a faux increased density, which gives her more of a result with less risk. Are you doing it okay?
Good, yeah.
Good. So I always tell you guys that women are the strongest when it comes to laser treatments, especially the ones that are very athletic. Because they're used to hard workouts and pain, especially the hot yoga. Do you do hot yoga?
I have.
See? That's what I mean. Not sure. But you're just usually a little bit stronger. I'm a baby. Even though I work out, I'm still a baby with lasers. Although I had residency with something before. So you can see we're doing some overlaps and really following a pattern. It's really important that this is customized properly and done by an expert. The most important thing besides this treatment is the post-care, which will require about a week of serums and creams and doing light therapy. In the past, we used to do petrolatum and occlusive gels. It's not good for the skin, and that's why in Q1 of 2020, you'll be seeing the Emerage skincare post-care kits that has a special enzyme in it from the seed. We'll talk about that when it comes out. But it helps. It's a 2-week treatment to help you heal much faster from lasers. And it's amazing. Oh, she's right.
How does this laser compare to other skin resurfacing devices?
I'll tell you right now, this is the #1 scarring and resurfacing laser on the market. Obviously, what matters the most with lasers is whose hands it's in, not necessarily what the laser device is. Because I can take any CO2, you put me on a stranded island and I can still treat acne scars with it. But with that said, this is the device the government uses for scars and burns, which is what we're going to use when we do our non-for-profit starting next year for our scar and burn patients. Turn all the way to the right now. There you go. With that said, there are new devices on the market that we're going to be testing. We have a new CO2 that we'll be testing really soon that I'm very excited about. So we will keep you guys informed. But you know, any car will take you from one place to another. If you want to drive in style, use the Ferrari, which is what this is. The Ferrari of CO2s. You know you can crash a Ferrari, so you got to be really careful. And we're doing a nice 20 to 25% overlap. It's going to be even peeling. But the idea here is a really good, strong treatment for her. And with the right nerve blocks, with the subcision combined with the filler, and doing the deeper needling, she's going to get a much better result. You're doing really, really good. Are there any other questions there or no?
Not really. Is this good for darker skin tones or?
No, the CO2 resurfacing is too inflammatory. That's why you can do things like the halo or the profractional and lighter densities For those that are darker skin types, CO2 is too much heat. Remember I told you, even though this looks superficial, the heat extends very deep. This is like a flamethrower to the skin. So right now, you don't see the devastation, but later, she's gonna wake up swollen and red and peeling for this week. But that's what we want. It's a control way for us to improve scars. That's why it has to be done properly. We pre-treated her skin with the proper skincare and peels.
Could you name a few?
Skincare products?
That you used pre-treatment.
We have whole videos on it on our YouTube, if you guys are interested. We always use kojic acid, retinol, hydroquinone. And lately, as a healing sort of skincare preparation and moisturizing, we're using both Sente and fake Mame Labo for getting the skin moisturized and hydrated. You can see very pinpoint and even. She's doing quite phenomenal. Turn it over here so make sure it's even. We're going to drop. We don't miss a spot, you guys. So we're covering all along the nose. We want to get those blackheads. And go all the way up to the eye.
Does this laser help with pore reduction?
100%. But remember, pores are genetic. So they'll look a lot reduced right afterwards. And then you got to do things to keep them protected and shrunk, such as facials and retinol and exfoliation and microdermabrasion or micro needling, salt facial, etc. Go up a little higher just so we get her a little more of a cosmetic result under her eye, around her eye. Good. Turn to the left. There we go. Very good. A little higher, just make sure.
And this is the Active Effects handpiece?
Yes. Very good. And then we blend the edge.
What's the downtime for this laser?
About a week.
A week?
Yeah, she's getting ready for the holidays. We gotta get her looking good. Remember, our combination together is gonna give her better results, just a little more of the downtime. Okay. Okay, you guys, so that's CO2 resurfacing for acne. Stay tuned. We'll watch how she heals over the course of the next 1 to 2 weeks.